With Trump's big, beautiful bill, I heard someone once said travel nursing is about to get real lucrative and is about to skyrocket. With what money, sis? With whose money? I'll wait. Remember, hospital contract with travel nursing agencies directly for staffing needs. Within these underserved communities and hospitals, majority of funding comes from patients with Medicaid. And if there's cuts to Medicaid, budget gets tight, facility starts to close, jobs will be lost, ER wait time increases, care for everyone will be delayed. And if you think the same people that put this bill in place is going to give us a helping hand, please think again. Had they given a flying fuck, they would have considered the effect that this bill would have had in the first place. So here's where it hits home. The burden, stress, and anxiety of healthcare workers are already through the roof. All I'm saying is start to pay attention to what's happening in politics and have a plan. Because these changes being put in place will have a direct effect on you and your families.
Okay, so I'm a bedside nurse and I love bedside nursing. I knew I wanted to be a nurse since I was like the age of 8 years old. I love being at the bedside. I love talking to my patients and getting to build a close relationship with them. I love being that light on the darkest day of their lives. And even though I am getting a higher degree in leadership, I don't plan on leaving the bedside for a while because I love it that much. I love the fast paced. I love, just the constant movement of taking care of patients directly. And I know at some point in my career, I'll move out of that, but I love it. And I'm getting to that point. I've been a nurse for 7 years where I feel like so much of being a nurse is just very disheartening right now. And I think it's kind of hard to go to work and smile at my patients and be there for them when so much is happening that just kind of undoes the work we do as healthcare workers. And what I mean by that is that there's so many things set in place that ultimately do not help the patients that we take care of get ahead. And that's why we see the same patients in the hospital, every week or every month. And we dismiss them to unsafe places because we don't have any other option to do so. I think with what's going on in the government right now, like whether you're a Republican or Democrat, this affects all of us. And I work in an ortho trauma floor in Nebraska, a trauma hospital. And many of the patients I take care of, they pay for their hospital stays through Medicaid. And then when they discharge to like a nursing facility, they pay with that through Medicaid. And so many people are going to be left in the dark if they lose their Medicaid. And it's really just sad to see. This funding is important for so many other things. And I've taken classes on policy. I've taken classes on how the government affects healthcare. And the reason that you can have a heart attack or an emergent situation and you can be transported to a trauma hospital within 5 to 10 minutes is because a trauma hospital exists. When you lose the funding that we will potentially lose, it'll take you 45 minutes to an hour to get to hospital care. And that is the difference between life and death. This, no matter what political party you were in, will affect all of us in a way. It could affect us directly. It could affect somebody we love. And this is something that we should all, be worried about and be taking very seriously. Nebraska, I think itself is going to be at risk of losing or closing like 6 facilities. And ultimately, the rural communities will suffer because those people will have lack of access to adequate health care. And even if they did make it to a facility, there could be a chance that you still need to be transferred again because that facility might not be able to accommodate your needs. It's just really getting to me that I just wish there was more I could do as one nurse to change the situations that people find themselves in and that they'll continue to find themselves in because of our lack of the ability to care for these patients. And I'm really, really thinking about all of those people because it will affect so many people. These people won't just have to worry about where they will discharge to, then they'll have to worry about being able to get their medications. And we already know what happens when people can't afford their medications and they're going to be getting infections that they can't treat because they can't get their medications. They're going to be suffering from chronic pain that they can't treat because they can't get their medications because they can't afford to do that. And I don't even know what I'm rambling about. I just wish that our healthcare system actually cared about caring for people. And I think at the beginning of my nursing career, I was able to be pretty naive to that stuff. But as I've kind of gone up the ladder in management and leadership, I've just kind of been more aware of these things because I get more insight to them. And it's just awful. And on top of that, then, you know, we have people in the medical field that don't believe in science. And it's just like, it's so much all at once. And I'm just trying to be better and be a better nurse. And I don't know if any other nurses feel this way right now, but I hope it changes for the better because I love what I do and I don't ever want to leave nursing because I know this is my passion. But I don't know. Ignorance is bliss sometimes, right? Well, bye.
It's going to be bad. Let's chat. So first of all, this bill affords less money to healthcare facilities, but especially rural ones. So the biggest thing I can say is that there are going to be a lot of cuts to staff, which is going to lead to longer wait times and a lower quality of care. Another thing that's going to happen is that this is going to lead to closure of a lot of facilities, especially those in rural areas. So they're going to have to drive further for care. Will potentially pay more to see a doctor under this new rule, and Medicaid is going to be harder to get and keep. So they're trying to make the enrollment period shorter, and they're trying to make the rules for having it more strict. So all I can say is that this is going to be really devastating to Americans everywhere. It is going to affect everybody or their loved ones in some way, shape, or form. If you have
Please don't shoot the messenger. I'm just a doctor trying to give you a health update about what's really happening. This big, beautiful bill is going to it's selectively targeting healthcare for children who predominantly rely on Medicaid, little known fact, Hispanics, and African Americans. First, as a society, it's immoral. We have a responsibility to help provide health care, which is a human right, to the most vulnerable people in our population, children. I don't understand how you can take that away from them.
The big, beautiful bill passed, and wow. Academic hospitals are overseeing the care of a lot of patients that receive Medicare and Medicaid, and that's exactly what funds residency positions that trains new doctors. So this is very concerning, and we will keep fighting. It doesn't stop here, but just knowing that the future of medicine will never be the same again is devastating. And I know I speak for people who are already in medical school or are in their residency training, that this is especially frightening for those who are going through medical school and getting Grad Plus loans, who might not have all the benefits that previous people have had. As someone who was the first in their family to go to medical school, who relied on Pell Grants, grad loans, everything in between to make it to where I am, and still be in $250,000 of debt, it is very difficult to get to this point. How are we going to keep America healthy? How are we going to keep supporting the future of America if we don't have enough physicians or protections to make sure that people can get the education to provide the care that America needs? So for all the medical students and residents out there, even pre-medical students, share your voice, share your story. Never stop advocating for yourselves or for the future of medicine. For a patient who receives care at a university hospital where you see residents, think about them next time you go to the polls and vote. Think about who you're voting for and what their policies and platforms really mean.
To anyone working in healthcare, we need to talk about the big, beautiful bill. Because here's what most people aren't saying out loud. The bill actually doesn't go into effect until 2026 and 2028. While it sounds like big change is happening now, it's not. The financial aid reforms, Medicaid changes, healthcare impacts, they're all delayed. And by the time they start hitting, we'll have gone through another election. That's not by accident. That delay creates setup for the perfect blame. When students lose access to graduate loans, when OT services get cut under Medicaid, when workforce shortages get worse, they'll point the finger at whoever is in office then, not at the people who wrote this bill. We have to be smarter than that. We need to track what's coming, understand how it affects our professions, And remember who made these decisions, because they're counting on us to forget. So if you care about healthcare access, watch what happens after this year, because that's when the real story starts.
I would love for a Trump supporter to define disability to me. Define what it means to be able-bodied. What's their understanding of being able-bodied or being disabled? Because I guarantee they do not have a great grasp on the subject, but I, for some reason, keep seeing them say, well, it's actually only able-bodied people who are choosing to be unemployed who are going to get kicked off their health insurance, which would still be bad if it were true, but it's not. That's not true. But they also definitely don't know what it is to be able-bodied. Like, they don't understand that disability is like a spectrum. Every time I've seen one of them say it, I'm like, first of all, wrong. Second of all, still would be bad. Third of all, define disabled for me, please. Please, I'd love to hear your definition of what it is to be disabled. Bozos.
Saw the video of the young lady who said that now that the big beautiful bill has passed, nurses get ready because there's going to be this influx of patients in the hospital. And everybody is like, oh no, sister, you got it wrong. That's not how things are going to work. When she's talking about an influx of patients in the hospital, what I perceive that to be is that preventative care is going to suffer first, because if people don't have insurance, they can't make these appointments to be able to follow up and stay on top of whatever chronic conditions they have, or, be able to just basically get their regular checkups to catch anything earlier. Meaning they're going to begin to use the emergency room as their primary care physician, which a lot of patients already do. And so I can see how in the beginning, it might look like, oh yes, there's an influx of patients. I mean, because there is going to be an influx of patients coming into the emergency room and then being admitted to the hospital and blase, because they don't have insurance to be able to stay on top of whatever pre-existing conditions they already have. And yeah, that's going to overwhelm the system a little bit. But there, for one, will probably be more nurses seeking out those hospital jobs, so we'll have more people applying for those positions. But the biggest issue is, how the hell is the hospital supposed to get paid and reimbursed for all of those ER visits? They're not. So yes, there might be a lot of patients coming into the hospital that people will have to look after. But how long is that going to hold up before that hospital can no longer sustain because they're not being reimbursed for the resources that they're putting out? In COVID, we kind of saw something very similar where people had lost access to their primary healthcare providers prior to us actually getting into the whole telehealth thing. And so a lot of people weren't getting the follow-up care that they needed. And unfortunately, they were too afraid to come into the hospital because they felt like if they came into the hospital, they would get sick from all of the people who were there seeking care for COVID-related symptoms. They allowed for their condition to get so bad that they ended up coming in by ambulance. I'm talking something as simple as someone who suffers from chronic constipation coming in with a bowel obstruction so bad that they now needed emergency surgery. Kind of scary to think that this potentially could be the reality for a lot of people, all because they have lost access to outpatient and preventative care resources. I know that this administration and people who support it are trying to justify the cuts for Medicaid by saying that this is a way to combat fraud within the system. All I can say to that is I'm not here to debate whether or not that's the truth, but in due time, we will see. So enjoy your temporary bag, because it doesn't look good for the long term.
Imagine thinking that someone doesn't deserve health care. Like, just imagine believing that if a person doesn't have a full-time job that provides benefits, or even a part-time job that doesn't, you just inherently haven't earned the right to go and see a doctor if you're sick. Like, I remember being in high school and only just starting to become aware of the world of politics. And it was during Obama's first administration. And all that they could talk about in the news was Obamacare and the Affordable Care Act. And I remember asking my dad about it. And when he explained what it was and, the whole concept of universal health care, I was just like, my first thought was, people are opposed to this? Like, this is a controversial thing? And my dad said to me that there was a certain political party whose politicians and constituents believed that if it doesn't affect me, it's not my problem and I don't want to pay for it. And it's just been on my mind lately because of the whole big ugly bill thing going on and how all of these Republican politicians just clearly do not give a fuck if millions of people just lose their health care. And I just find it so funny that the Republicans' favorite talking point is that the libs are entitled and they just want free stuff. When I can't think of anything more entitled than believing that certain people just inherently don't deserve the basic human right of surviving and taking care of your health. Seriously, how miserable of a person must you be if you believe that poor people just don't deserve to see a doctor? The Republicans love to claim that they're the party of family values and all that shit, but